Hello everyone, today we'll be studying about the Decade Missing Filled Teeth Index, that is known as the Dmft Index. The Decade Missing Filled Teeth Index or the Dmft Index was developed by the Henry T. Klein, Carroll E. Palmer and Knudsen J.W. in the year 1938 to determine the prevalence of the coronal caries. So the advantages are, it is simple, rapid, versatile, universally acceptable. Now the procedure. The Dmft Index is applied only to the permanent teeth. It is composed of three components: D, M, F. D means used to describe the decayed teeth. M used to describe the missing teeth due to caries. F means used to describe the teeth that has been previously filled due to caries. Instruments used are mouth mirror and explorer. All the 28 permanent teeth are examined. The teeth which are not included are: the mnemonics is cutter, C for congenitally missing and supernumerary teeth, U for unerupted teeth, T for third molars, R for teeth removed for the reasons other than the dental caries such as for the orthodontic treatment or impaction, R for teeth restored for the reasons other than the dental caries such as trauma, fracture, cosmetic purpose, or for use as a breeze abutment. Now the last mnemonics is R. So the primary teeth retained with the permanent successor erupted. The permanent tooth is evaluated since the primary tooth is never included in this index. Now the criteria for the identification of the dental caries are: the lesion is clinically visible and obvious. The explorer tip can penetrate deep into soft yielding material. There is discoloration or loss of translucency typical of undermined or the demineralized enamel. The explorer tip in a pit or fissure catches or resists the removal after moderate to firm pressure on insertion. Now we have the principles and the rules for recording the DMFT. The mnemonics is Dmft. Okay, so we'll talk Dmft. So O for no tooth must be counted more than once. It is either decayed, missing, filled, or sound. Again, S for the decayed, missing and the filled teeth should be recorded separately since the components of the DMF are of great interest. Now next is D. It is talking about the decayed tooth. Okay, when counting the number of decayed teeth, also include those teeth which have restored with the recurring decay. Now next we have F. The temporary restorations are considered as filled. M. It is talking about the missing. Okay. Care must be taken to list as missing only those teeth which have been lost due to decay. Also included should be those teeth which are so badly decayed that they are indicated for extraction. That is, there is no possibilities for saving the tooth. That is, the extraction is indicated. Then in those cases also we give M. Okay. The following should not be counted as missing. They are unerupted teeth, missing teeth due to accident, congenitally missing teeth, teeth that has been extracted. Now F. A tooth, it is talking about the filled, right? A tooth may have several restorations, but it is counted as one tooth. Now next is D. Deciduous tooth are not included in the DMF count. Next is E. Erupted. The tooth is considered to be erupted when the occlusal surfaces or the incisal edge is totally exposed or can be exposed by gently reflecting the overlying gingival tissue with the mirror or explorer. Now the next is the tooth is considered to be present even though the crown has been destroyed and only the roots are left. Suppose here only the root portion is left and the crown portion, this crown portion is not present, only root is present and this is the gingival area, then it is also considered to be present. So next we will be talking about the limitation of the DMFT index. The mnemonics is PERMIL, P-E-R-M-I-L. Okay, so R for risk. The DMFT values are not related to the number of the teeth at the risk. The DMFT index can be invalid in older adults because the teeth can become lost for the reasons other than the caries. I for invalid. The DMFT index can be misleading in the children whose teeth has been lost due to orthodontic reasons. M for misleading. The DMFT index can be oversight caries experience in teeth in which the preventive fillings has been placed. For example, pit and fissure sealants are placed. then people may tell it as it is decayed tooth, right? So the DMFT index can overestimate the caries experience in the tooth in which the preventive fillings has been placed. Next is L. The DMFT index is of little use in the studies of the root caries because we know that the DMFT index is for the coronal caries, right? So little use in the study of the root caries. Next is E. E for DMFT index equates a disease state which is healthy state by assigning the same score for decayed tooth as well as the filled healthy tooth. If one tooth is decayed, we give D 1, okay, and if it is filled healthy tooth, then also we give filled for 1. So 1 same. There is same score for decayed as well as healthy tooth. So the WHO modification of the dental caries in 1987. So the mnemonics is TC, okay. T for all the third molars are included. Again T. T for temporary restorations are considered as D. C for chalky. The initial lesions like chalky or the discolored rough spots and the stained fissures are not considered as D. Caries is recorded when there is an unmistakable cavity on the undermined enamel or softened wall or floor. Now next, so WHO modification of the dental caries in 1997 is PM, P for probe. The instruments used to record the dental caries are mouth mirror and WHO or CPI probe, and M is M component. For the individuals 30 years and older, the M component should comprise the teeth missing due to caries or for any other reason.